Back pain is a fairly common problem, ranging from mild strains that can be better in a week to severe nerve pain that can last for years. When we're young and we hurt our backs, generally what we're doing is we're straining the muscles. And when we strain the muscles, they heal relatively quickly, maybe in a week or two, because they've got such a great blood supply. Whereas another type of injury can occur when the discs in our back either bulge or rupture. The discs are these structures, they're circular structures that sit between the bones of the back, and they have a hard outer shell and a soft inner material. Well, what can happen is the outer shell can rupture or bulge and pinch against the nerve in the back. And that can create pain, not just in the back, but it can be referred pain that can go down your leg or across your stomach. It's very confusing to patients when they have back pain that's associated with these other problems. The third type of pain can occur simply from wear and tear. As we get older, our discs, they thin out, and the bones around the edge of the discs, they start to get irritated, they start to get rough edges and what we call bone spurs. And those bone spurs can end up pinching the nerve. And so that type of pain can be ongoing. Discs can heal over time. 90% of the time when a disc is injured and ruptures or bulges out, it's going to get better over time. It may take a month or two, unlike the strain that's just muscles that heal in a week. Discs can take several months, but 90+% of the time, they're going to get better on their own without necessarily having to have back surgery. The arthritis type pain can also get better. There are medicines that can reduce nerve root pain. There are things like physical therapy and acupuncture, chiropractic care that can help to reduce some of the nerve irritation. And so it's important to get to see your family doctor. If you have this kind of, especially referred pain that's going and moving down away from your back, get in to see your family doctor so that you can get on treatments or medications that can help you get over your back pain. And then keep your core muscles strong. Try to avoid having extra weight around your midsection, because if you think of it, that added weight squeezes on the discs and is going to make them bulge more. So keeping your core strong, walking is a great exercise, walking in water, Tai Chi, Qigong, yoga, Pilates, core strengthening, swimming, core strengthening exercises can really help prevent back problems. Also making sure that you lift properly. Don't bend over when you lift. Make sure that you keep your back straight. Use your legs. Get help. Don't try to overdo it, especially if you're older. When you're younger, you might be able to lift something heavy and get away with it, but as you get older, if you try to lift something really heavy, you're more likely to injure your discs, especially if you do it in an awkward position and if you don't do it all the time. If you're someone who the part of their job is lifting all the time, you're going to have strong muscles and ligaments, but you don't want to be kind of a weekend warrior lifting heavy things and potentially causing permanent damage to your back. So stay healthy by keeping a strong core, lifting properly. If you have back problems that don't get better, be sure and get in to see your family doctor. That's A Minute for Health.